Alzheimer's disease is the most common form of dementia. It's already a big public health problem, and it's set to get much worse with the aging of the population. The onset of Alzheimer's disease is really insidious, but it progresses slowly over many years to rob a person of all their mental faculties so that they are unable to live without constant care. Alzheimer's disease starts with a worsening of memory, that is, referring to the ability of people to keep track of the events in their lives. Of course, as people get older, they have some memory complaints, but it's the worsening of episodic memory that is the hallmark of early Alzheimer's disease. Our work has uncovered changes in the brain that occur with memory loss at older ages. This is a condition of the brain that is preclinical for Alzheimer's disease, but is perhaps important to understand why aging is the major risk factor for Alzheimer's disease. This transitional condition between normal aging and Alzheimer's disease today is called amnestic MCI. That is when people have memory loss that is greater than would be expected for a person's age. We discovered, and perhaps it's surprising, that in a particular part of the brain that is important for making episodic memories, there are specific cells that are overactive when memory is failing. If that activity is reduced so it is more in the normal range, memory is improved. That work was done in animal studies, and a drug that was effective in that condition was levetiracetam. This is a drug that has been used for many years to treat certain forms of epilepsy in humans, so it's safe for use in man. Based on the animal studies, the clinical trial that we're reporting tried this drug in amnestic MCI. In patients that were on, amnestic MCI patients that were on levetiracetam, the drug at very low doses reduced that excess activity and made their memory performance during the scanning task improved. Relatively recent research provides a hint of why that might be the case, because some of the brain physiology that causes or is part of the disease process in the brain is driven by neural activity. So if there is excess activity going on in amnestic MCI, it's kind of like having your foot on the accelerator when you're driving down the path to Alzheimer's disease. So controlling that excess activity could be like taking your foot off the accelerator or tapping the brakes, and possibly could slow the progression on that path.